Eventually, everyone moves on from grief, or do they really? Or do we always carry it with us, living it every single day and learning to live with it? Joining us on the show is clinical psychologist Dr. Vandita Dubey to talk about what is this grief and how do we really live with it. Thank you very much for joining us on the show. So take us through the stages of grief.
So the whole idea of stages of grief is based on observations of this lady called Dr. Kubler-Ross, and she observed that there were some common things that people go through. It's not really stepwise, so it's not that one follows the other then the other. It's different emotions or experiences that people have, and any can follow any, and you can keep going back and forth, and so it can be quite a jumble actually. But the different things that people go through are, often, of course, when you hear about a loss, the initial reaction is shock and disbelief, denial. Even if somebody's unwell and it's going to happen, that's not something that you're expecting when it happens. They can be bargaining. If I had done this instead, or if I had gone earlier, or if that person hadn't stepped out of the house, or this hadn't happened, or that had happened, that whole thing that goes on in one's head. There is anger, of course, and sometimes the anger can be towards one's own self for not being able to prevent it. It could be anger at an institution, at a hospital, at a doctor, it could be at family members, it could be at God, depending on what one's beliefs are. So often anger, and it can take the form of rage, or it can be just irritability and all of that. Once all of that happens, there is also sadness. There is immense sadness, a feeling of being just completely left alone, abandoned, complete loneliness and yearning for the other person, whoever one is lost. At some point between this going back and forth and from anger to bargaining to denial, at some point there is acceptance, which is in a sense saying that okay, fine, this has happened, it's happened, and one can't reverse it no matter what. Life goes on. And a lot of people then also get into the whole thing of making some meaning out of it, and that's when we see things like you might create a shrine for the person, or you may volunteer somewhere, or give to charity, or create a charity in their name, or take up an issue or a cause or something like that related to the person's death or something. So in some ways, finding meaning, finding purpose. But sometimes there is also guilt, and guilt is in itself also an emotion, and also depends on the circumstances of the death. And it can be an emotion which again complicates everything and keeps coming back and forth, going back and forth. One keeps moving in and out of that emotion. People may also feel different things. I mean, in like, for example, the losses due to accident or riots or whatever, there'll be a bunch of other emotions also which are part of the whole thing and may complicate the whole grieving process. So it's actually different for each person and different in each circumstance in a way.
It seems like there is a reaction to the grief itself. I mean, you're just not able to comprehend or process what you're feeling, because what you expect to feel is just sadness. And that never happens, because you end up feeling a lot of other emotions, and sadness is almost like pushed to the background. I can only speak for myself. Like, when I lost my brother, my first reaction was numbness. And I was back at work in a week and ready to talk about everything else except what had happened. But I expected to feel that deep sadness, which actually was overpowered by the anger that I felt, the irritation that I felt, the restlessness that I felt. And somehow I missed feeling sadness. And that's the reason why I wanted to have this discussion. Is that I don't know how much of sadness was felt. How does one explain that?
So, for any human being, it's not that we only experience one emotion, or that there's just one emotion that's there all the time. We do move between a bunch of different emotions. Sadness is one of the hardest emotions to experience. Also, I mean, the numbness that you talk about is a part of that sadness, because it's an overwhelming feeling of, in a sense, despair, yearning for something different, knowing that that's not possible. So numbness will also be there, experienced as numbness, and then it maybe experiences sadness. But pure sadness is not all that you experience in grief. It is a mix of emotions. It is going back and forth between different emotions, because our thoughts also change. And that is what pretty much everyone who experiences a loss goes through, is all these different emotions. Now, you talked about the reaction to the loss and then the reaction to the reaction. So you're angry, you feel anger, and then you take it out. It comes out in conversation with somebody else, or as blame towards somebody else, or as just irritability. Then, of course, it's come out in behavior, and then there's that part of one which feels responsible, because then, of course, if it comes out in an interpersonal relationship, then it has an effect on the other person. So then there's perhaps guilt about that, or feeling that, one shouldn't behave this way, kind of a thing. So there's that self-censorship. So coping with these strong emotions is difficult, and that is when we also see that a lot of people, in trying to cope with these emotions, end up resorting to things like alcohol and stuff like that. Or you cope by like going into work and just completely throwing yourself into it, so that these emotions are a little kept at bay, and one is kind of occupied.
The reason why this means so much is because I've been through it. I have not been able to explain it, and that's why this journey to explain it, because if somebody is going through this, perhaps it will make sense that no two experiences are the same. What I felt, what somebody else felt, is completely different. In fact, I've now lost 2 members of my family, and losing my mother was completely different from what I experienced with my brother. And I expected to feel exactly the same. The point is, everybody else's reaction is different. Every reaction to every death is also different.
Yeah. Also because each relationship is different, right? Each human being is different. So each connection in that sense is different. So hence each loss is different. And in some ways, so it's easy to label things and put them in box and say, okay, there's anger, you'll feel denial, but what it'll feel like really, or what specific thoughts really will come up, or how that journey will be different each time. And I think sometimes it's also, that in a sense, if grief is not expressed, if that sadness and that whole journey is not gone through, then it kind of stays there, and it can get tapped into when there is another loss. It's like it's kind of sitting there in a sense, and you kind of just dip into it, and it's like a well.
It's also the circumstances with which you lose a person, right? I thought, again, that the grieving process was similar. If you lose someone suddenly to someone who has terminal illness, and you watch them go, that emotion that gets expressed, or the grief that happens when somebody is diagnosed with a terminal illness. It's almost like grief hit me when my brother was diagnosed with a rare form of cancer. It was far more overpowering in retrospect than actually losing him, because it was literally seeing him go. What do you call that? Because he's still there, but you felt grief when that person still is there.
Yeah, see, that is also Because there is often a deep sense of helplessness, right? Because it's somebody you, of course, love and care for deeply, and you see them deteriorate or not be able to do things, or whatever. The anticipation is always a lot harder. There is time, so theoretically it's possible to do something, yet there's nothing you can do. And helplessness is again one of the really, it's one of the hardest emotions to feel. So it's losses of many kinds.
There is a possibility that certain deaths leave a scar on a child, right? What can other people do for the child?
I guess again for the child it depends on the relationship they have with the adult, whoever it may be. They're absolutely affected by the loss, and in some ways that suffering one cannot take away no matter what. Talk to children about it and talk through it with them. It can come out in many different ways. Children may or may not show visibly that they're being affected by it. But oftentimes, actually, the thing to watch out with kids is their play, because sometimes you'll just see it being enacted in their play or in their dreams or in their sleep. But when you see that a child's sleep is being affected or behavior at school is being affected, it's affecting them much more deeply, and they need an outlet. They need to be able to express it in some way and talk their way through it. Age of the child makes a difference as to what they'll go through and how it'll get expressed.
What are the signs to watch out for if it's a very young child? It could be a child of 5 years or 4 years. What are the warning signs to watch out for?
So with children that young, it's usually things like sleep, their behavior. Are they playing as they used to before? Are they not? Are they acting out? Sometimes you see it more as aggression or irritability or just fights or whatever that they're doing, or tantrums that they're throwing. It could be physical signs. It could be more stomach aches, more earaches, more other aches, pains kind of things. They can't verbalize and say, this is what I'm feeling, these are my fears. In fact, at that time when you see a child like that, is to of course get help for them, but also to talk to children and give them the facts in as age appropriate a manner as possible, and also reassure them without giving false reassurances, saying that okay, see, I am here for you. Sometimes it helps to share your own process without completely breaking down, because it also happens that if you completely break down and all the time in front of a child, then they will hold back because they'll feel that you're not ready for their own emotions to come out. And children try to protect their grown-ups. So it's important to verbalize and give them the language and say, okay, I'm feeling sad, I'm missing the person really, and I'm worried about this, or I'm concerned about that, whatever it is, so that they have the language at some point to perhaps even express it verbally. But with little children, I think sometimes play and drawings are a great way really to get children to express whatever they're feeling, and they can have very different concerns from grown-ups. For a mother, it would be, okay, how do we make ends meet, or what will happen about this or that, or they might be practical concerns, or they may be different kinds of things. For kids, it's very, it could be something very hard to imagine.
No, but here is the concern, Doc. Every time we've talked about mental health issues or even mental illness, one of the things is trauma in childhood. And would you say that losing somebody that one loves at a very early stage in life could actually be very traumatic?
It could be, but it all depends on the circumstances.
So how can the other parent or the remaining family members around, or loving caregivers, how can they make sure that this the trauma that the child has faced doesn't stay, that they are somehow able to help with that?
There are children who lose their parent, but they grow up fine. I mean, there is that loss, of course. It will make some difference. I mean, everything makes a difference to us as human beings, all our experiences. But they grow up fine. And one of the important things for children is to have some semblance of normalcy, even through the whole process. At least there is some sense of stability. Human beings need stability, even for grown-ups. The day is moving in some structured way as it was before. So trying to maintain that as much as possible, while also keeping conversations open for children to talk about their feelings or express their feelings however they express. Rituals are sometimes important because they give a sense that there is a community, there is this family, there's other people who come and all of that. But then also that they could go and that they go and play, that it's okay to play, right? That they don't have to not play or hide their play or feel bad about playing or listening to music or singing or watching a movie or watching a cartoon, whatever it is that they do normally, doing those things.
So you should not force the child to doom and gloom. Especially when he or she is going through raw emotions. You should encourage the child to do what they love. Let's talk about adolescence. And that's where I think a lot of avoidance behavior and denial happens. So again, what can parents do best? Or what can the remaining caregivers do if they have lost somebody dear? It could be a grandparent, a parent, even friends, So what can the other people do around them?
One is, of course, again, talking to them, asking them, how are you doing? What are you thinking? This is what I'm feeling. And sometimes it's more helpful to just say, okay, this is what I'm feeling, this is what I'm going through, this is how I'm dealing with it. And then that opens up the space for them to say, okay, this is also what I'm feeling, or this is not what I'm feeling, or whatever it is, right? So kind of making room for those conversations to happen. And the thing is, if you open the door to it, it may not happen right then. You can't expect to sit face to face and have a conversation of actually any kind with a child that age, adolescents. But if you keep the door open, it may come out a week later or a month later, or in an entirely different context. You're driving somewhere, you're doing something else, you're cooking, you're whatever, and they may ask a question, and it may just stop at that little question. It may not go into a long one-time discussion. That's never how it happens. So it'll be little bits. But as long as they know that you won't get overwhelmed by their questions, or you're going to avoid certain questions, or you will not answer, then they will come up. So the thing is not to shut the door.
That's a very important point that you've just made, that don't expect lengthy conversations soon after an incident or soon after somebody has died with an adolescent. That's too idealistic of us to expect that. Wait for the questions to come whenever they come, as they come. Right?
Yeah. And I mean, for most things, you can't really have one-time conversation with an adolescent about anything. It's small doses, bits and pieces here or there, and more often than not in like let's sit down and talk kind of a thing, but more like, okay, we're walking somewhere, or we're driving somewhere, we're going somewhere, we're doing something else, and just having a conversation. So it'll always be bits and pieces, but then as long as they feel, and they test, often kids and teenagers will test you. They will say something and they'll wait for a reaction, and if they feel that you are getting overwhelmed by that comment or statement or whatever, or you're not going to answer it or whatever it is, then they will not follow up. They will not complete what they're asking. So it's just being aware and just being open to whatever they're bringing up, and just addressing it as best as possible, and also being open about your own journey, your own experiences, your own emotions at that point in time, and what's happening and how one is dealing with them. And so that kind of helps teens talk about stuff.
I want to talk about the elderly and how they are affected by grief. My father actually didn't express any grief, and we were worried about that. And then we took him out on a holiday, and he expressed a lot of anger instead. So we did not see any grief, we did not see sadness, we did not see crying. We saw immense anger lashing out at other people. I want you to take us through what you can expect and what you can do with elderly people, because they are also at a very sensitive age, right? And they could lose a child, and that's the unnatural part of death itself, watching a child die, but also losing a spouse at that age after having lived with them for so many years. So take us through that and how best family and loved ones can handle that.
Of course, the anger that expressed, that is also grief. Just different phases of grief.
That's interesting. So that's not anger in isolation. That anger is also grief.
Yeah, that's grief. And if it's taken him this long and it's built up as anger with him. See, anger is still an easier emotion to express than sadness. And if that's been within him and he's come out, and that's okay. These are different facets of grief. But if somebody is just stuck with only anger, that means that they're not allowing themselves to experience the other emotions, or unless they're doing it very much in private, that they don't want anybody to witness it. So I think anger becomes one of those things that when anger is expressed as in very intense sadness, also when it's expressed, it's difficult to watch, it's difficult to bear as another person, right? So oftentimes in some ways we also avoid facing that with another person, right? And we may in some ways discourage the other person from doing that, or just kind of basically avoid it. So I think with the elderly also, just giving them an opportunity to talk about it. If it comes out in anger, let it come out in anger. Once it comes out as anger, and it may have to be once, twice, thrice, 4 times, 5 times, 10 times, then perhaps it'll move to another emotion and something else. Sometimes people just have to talk about it again and again and again and again before they can talk about it in a different way or look at it in a different way. The loss doesn't go away. The loss is part of life. It's going to be part of life forever. You somehow just kind of integrate it into your life. It becomes part of you, part of your experiences, and you move with it. You can't leave it behind. I mean, I've heard of people where the loss is very sudden. Like a father I was speaking with who had to narrate the exact sequence of events again and again and again and again and again, and that's okay. The thing is, again, just to make space for that to happen and just be there. I mean, nobody has the right words, nobody has a solution. It's just being there that helps people kind of move.
In a cultural context, I don't think we talk about how the family dynamics change when a person passes. Mostly I've seen male members passing and there's a dramatic change in family dynamics. Is that something that is common, and how does a family work through it, because it splits families?
So yeah, I mean, obviously it's when you lose one member of the family, it does kind of result in lots of different things. So one is, of course, how each individual member deals with their own grief, right, and what impact we have on the other person. So if somebody who's still very stuck with anger, then and it comes out in the family, in the house, then it's going to have an impact on the other people, right? So in that sense, interpersonal relationships get affected, change in some way or another. Dynamics change, again, depending on who the person was, what their position within the family was, their decision maker or not, or whatever, all of those things. So, and then the practicalities of who has to now step up, who has to now make decisions, how is that? So yeah, so lots of dynamics do change, the relationships change. But in some way, I think, and I've seen, some families do it to have a time when you come together to celebrate the person's life. A year later, you have the ceremony. So in some ways, these kind of rituals, so whether it's through a ritual or it's like a birthday that you celebrate and the entire family comes together to celebrate their birthday. So that kind of helps people stay connected when somebody who's central to the family dies. But again, if it's a family that's living together, then yes, it will change some dynamics, and that whole upheaval is natural and it'll happen and it'll come to some kind of a place. But if it seems like it's really tearing people apart, then perhaps it's worthwhile getting help, because it usually tears people apart when there are unsaid emotions, when there are maybe resentments from somewhere that are carried over, or other things, so there's stuff there, there's issues there that are not getting resolved or not getting talked about in a way where the family can move forward.
What I mean is power dynamics literally changing, right? And not everybody is comfortable with that change. What do you do then?
Well, I think if people can bring themselves then more to really talk about what it is that's bothering different people. Right? So if there are two families, there's something going on there, the issues one has with the other, whatever the conflict is about, that has to be talked about, and also perhaps it's about, if there are young children involved, then maybe saying that, okay, let's look at the welfare of the young children, what's best for them, and will it really be great for them if the entire family falls apart. Two families falling apart is not helpful to these children, as versus having two families which are there for them. So somebody will have to take leadership from those two families to talk about it in that way and to figure out what's bothering who. And it could be a matter of that people are expressing their grief in very different ways and they haven't really figured that out, or that the anger is coming out at the other family. The anger that's related to the grief around the loss is really coming out there, and it's being destructive. And it does happen, you're right, it does happen that there are often families that fall apart under the weight of grief and how different members deal with grief.
And one thing to remember is that the grief may have come and gone about somebody's passing, but not to inflict on the child or children involved a larger grief by cutting off communication with families and with people that they have loved in the past. I think that is more detrimental for the children.
Definitely. I mean, then you, along with the loss of the parent and what that could have been in that relationship and all of that, you're also losing other relationships. So it's multiple losses.
Do you see that happening in families?
It happens. Absolutely, it does.
And so it's almost like double impact.
And this is the case. There are also cases where it's the loss of a child that leads to the couple splitting. And if there are other children there, then of course it's very, very detrimental for the welfare of that child, right? So you're right. It can split different families in different ways when grief is not allowed to express it in its different faces in different ways, and there's just one way that one thinks of, or one is not very aware or cognizant of how grief is impacting one's behavior in a way.
I have a question that is coming from SM from Gurgaon. She talks specifically about her spouse losing his best friend to a terrible accident last year, where he completely shut off and didn't even want to discuss his friend. And she wanted to reach out, but he didn't appreciate that. He became terribly moody, angry for months. Finally, almost 11 months later, she gave him an ultimatum and he agreed to go out on a holiday. He was finally able to speak and they came back to a normal life. But in all this, it was very tough on the kids because the kids hadn't seen the father behave the way he did. And her point is, people need to realize that the entire family is affected. So it's important to speak up, it's important to talk and communicate instead of shutting off. So what do you say to that? Because some people, they shut off.
You're right about that. I think also sometimes it's also about how we look at grief and, socially, culturally. I mean, there is this whole perception that you have to be really strong, or especially for men to be really strong, you can't really break down, you can't really show how you feel, or you can't show it. So where do you get support if you don't do it at home? Or sometimes people do it because they feel they need to protect the family from their emotions, and they feel that they can manage it, but they really can't manage it. It's too much, and it comes out in all these different ways. There's also this whole thing of you can't show grief publicly or at work. So where does it come out then, right? So it's also about how we look at grief and what space we give it to be expressed, and how even not just grief but any emotion for that matter, other than joy and happiness, I guess. Where do we give it space?
In all this, the sense that I get, and correct me if I'm wrong, is that it's really not a bad thing to talk about it with the children involved also. So even if you might be undergoing some sort of grief over the loss of someone else, it's okay to involve the children and discuss it openly so that they are aware. They don't blame themselves for what you are going through.
Yeah, absolutely.
Right? There's always this tendency of children blaming themselves for moodiness of the parents, right?
Yeah. So it's just that when people are going through grief, oftentimes people are not aware that this is what's happening to them, right? Nobody really knows the journey of grief in a way, right? We're not really aware. Normally we never discuss it, right? We don't talk about it. So how are you supposed to know about it unless you go out and really do your internet research now? But how would you know that what you're feeling is normal or not normal, or is how everybody deals with it, or is not how everybody? It's also about then, we all socialize in different ways to how we express different emotions, which includes grief. So, in somebody's family, how was grief dealt with, and what have they learned about grief? That informs how you will deal with grief when you come face to face with it, and also if it's a close friend or a close relationship, right? So most people who are going through grief don't know that this is what they're doing. And they certainly don't know that this has an impact, because grief is also a very all-encompassing emotion. It really absorbs you. Right? When you've lost somebody, you're within yourself. You're not really out there. So you don't realize the impact. So it's not out of a conscious thing that anybody does it like that. It's just that it's something happened. It's like, you have a hammer fall on your foot. It's hurting. Right? Now you may scream and shout in pain, or you may just go and sit in a corner and whine, or you may run to the hospital, or you may go from one doctor. You may do different things, right? Point is, right now all your attention is on your foot. You're hardly going to think about what am I looking like to somebody else? What's happening to somebody else? If I scream and shout versus what will happen if I whine and cry, or whatever, right? So in a way, it's hard, definitely. And in this case, it sounds like it's really, really hard for the wife and kids. But I guess all one can do then is really try to reach out to the person and say, okay, see, this is having an impact. It's having an impact on the kids. And also then talk to the kids saying, this is what the dad has gone through. Because see, this is an opportunity for the kids they're going to have to face with grief in their life when they grow up, or hopefully not before that. And for them to know that, when grief happens, you can talk about it. Right, rather than keeping it all within you. The mom could also approach it with the kid saying, okay, dad is being moody, like, or not talking, whatever, but that's because he's really hurt, because he's lost a friend, and that's how different ways in which it's coming out.
This comes from Hyderabad, KL Lalit. I felt terrible when Sri Devi passed away. I was a big fan from the 90s, and I felt the grief for days, even if I didn't know her. Is that weird?
No, that's not weird. A lot of people feel grief when public figures pass away, and sometimes it's because we've seen those figures. They've been a part of our lives. We may not have been individually a part of their lives, but they're definitely a part of our lives, and it's a loss. And losses are of different kinds. So, in a sense, it can definitely evoke a reaction in one. Of course, if it goes on for months and years, then you have to look at it and say, okay, how close was the relationship and how is it affecting me, and does it make sense? But definitely, feeling sad, feeling, whatever, depressed, whatever, for a few days, or whatever, when somebody dies is quite a common experience. It's
difficulty
normal.
In reaching out to someone who's grieving. What is the best thing to do?
I think the best thing that one can do is really just to let the person know that one is there, and then kind of keep checking in and just letting them know, and just be there. Sometimes just being there, just dropping in, picking up a call when they call, or just call to check in. So how are you doing? The person may not always open up and have something to share, right? But it's that they know that you're there and you're thinking about them. So when they do need to reach out, they can. And it's different with different people, but it's possible that you reach out and the other person, no, I'm fine, I'm okay. And that's okay. So there's no need to push somebody and say, no, you're not fine. So just giving that support and just being there, that's
because from the other point of view, sometimes you don't want to speak to anybody. Understanding that the person who's grieving needs time, needs to sometimes be on her own or on his own. It is also being supportive.
Absolutely.
Right?
Absolutely.
You don't necessarily have to be there, and sometimes that's
and
not
take over. True.
Sometimes just leaving them alone is also supporting somebody, right?
Yeah, absolutely.
Okay. Now, one last thing before we wrap up is really getting over it. Of course, there is a time, and the time could be different for different people. But we were talking about demons and trying to face those demons on a regular basis, and sometimes it'll take you 6 months, a year, whatever it is. It's actually rewiring yourself, right? How can you achieve that?
I think one of the things is just trying to keep a routine, So whatever your commitments are, not just signing off from everything and say, okay, now I'm just going to go and grieve. Trying to keep yourself going. Maybe there'll be days when there's a day when you just can't make it to work, it's fine. Or I do need to go to the gym. Giving yourself permission to do things which are fun. Going out and doing things which may seem like, okay, I shouldn't be doing it because it's not right. How can I sit and laugh when I've just lost somebody? But it's okay. Giving yourself permission, giving others permission if they're around you who are grieving, to do all these normal kind of things. So one is just doing the normal things while you're grieving, because it's not that you will grieve, it'll finish and then life will start. It doesn't work like that. You kind of do it, it'll be an up and down, and that's kind of, it's a rocky road, but you know, it'll move. And then just letting your emotions be, experiencing them when they come, as they come, in whatever shape and form they come. And sometimes at some point it may be about saying, okay, fine, what did this person mean to me? How can I keep their memory alive if that's what it's about? How can I give some meaning? How can I do something constructive? I've gone through loss. How can I help somebody else who might be in the same? So it's that whole part of finding meaning, doing that. And I think sometimes people also find it in very creative means. You can express what you're feeling and yet create. So even things like writing, poetry, fiction, whatever comes to you, doing a blog, you know, whatever it is, music, singing, art, it's okay to kind of let the emotions come out in that way as well.
So I'd like to end with the question that I started with, which is, can you really move on from grief, or do you carry it with you? And I think you've sort of answered that question several times in several ways, that it's never going to be something that you leave behind. It's probably going to stay with you, and you're going to have to live with it on a daily basis sometimes, and perhaps never move on, so to speak, from grief. But you'll be able to carry it better as time moves along.
Yeah, absolutely.
Thank you very much for joining us on Zen-Brain.
Thank you for having me here.